That way one man sees until where they find begin. One day you go born twins. Amen. Amen. You're not wait on losing job. Landlord come they do like God. One day you go be landlord. Amen. Amen.
Joy 99.7 FM.
If you believe it, say amen. No. Amen.
Amen.
Everything you put your hand go up.
Joy 99.7 FM.
Yourself go be a boss. Amen. Amen. Everything you put your hand go up. Your name go open doors. You self go be a boss. Amen. Amen.
That's right. Amen to you and to all our fathers in Ghana and across the world.
Joy 99.7 FM.
Just love this one from Timmy Dakolo. Amen. Everything.
Joy 99.7 FM.
Strangers go favor you. Great men go honor you. Amen. Amen. One day you go sign the check. Oh, you self go
Drive that Benz, right?
Makes sense. Oh, amen.
Happy Father's Day. I'm in the studio with Dr. Eugene Tete, consultant hematologist with the Hollywood Teaching Hospital. He's shaking his head. If I've made a mistake, receive it.
Go spray me money.
If you know a father of a child living with sickle cell disease, call him and say amen to him.
Dangote go be your friend.
Dangote go be your friend.
I go be your friend. I don't know God go be your guy. Amen.
That's right. Yeah, Father's Day. And yesterday was also World Sickle Cell Day. Day we devote to raising awareness, empowering everybody, affected and afflicted alike. An inherited genetic condition. But I'm not the one to tell you. I have a hematologist in the studio, a great friend of the program, and it's good he's been able to make it. We'll be joined later by Nimate Bochwe, who is living with the condition. Nimate got married last year. He tells me he will storm the studio with his wife. I see him waving at me. But Dr. Tete, thanks for joining us.
Yes, Nortey. It's good to see you again.
Right. And
I like your studio setting.
yeah,
This is
you
the
have,
first time
bro. Yeah, you haven't been here since
in a long time, yes.
yeah, in a long time.
I'm enjoying this one.
All right, okay. So let me just give you a breather as Nimate joins us. And like I said, Nimate is joining us with Mrs. Botry. I beg will make them comfortable. So if you just joined us on Joy 99.7 FM, the program on today, Father's Day, Ultimate Health, your ultimate guide to healthy living. This and every Sunday, 2:05, we are live by His grace. And today we take a look at a very serious public health concern, sickle cell disease. Let's understand what it is. Let's get all the empowerment. So I have Dr. Eugene Tete, a hematologist. And Bernard, is it Bernard or Benjamin? Benjamin Nimate. I know the Nimate Botry. He's with us in the studio. Gentlemen, you're most welcome.
Thank you, Nortey.
Right. Nimate, you made it.
Sure.
I like the fugu.
Thank you.
I haven't seen you in a long while. Great to see you.
Same here, though.
Great advocate. And Mrs. is not on mic, but she's with us. So I'm waving at you. And Nimate got married last year on my birthday, 28th of February, right?
Right.
Yeah. My birthday is 28th February. That's why I don't forget. That's why you can't dodge. So 1 year of great stuff. How's it been?
It's been fantastic.
Right?
I'm enjoying it.
You're enjoying
Yes.
the marriage. Okay. Right. Abeku is just need to unmask. These days we take all the precautions, so we're a bit more flexible. But many thanks for making it.
Thank you so
Dr.
much.
Tete, and we've talked about this several times over the years, but we still need to raise awareness every year.
Yes.
Right. And let's start off by giving Ghanaians the extent or the magnitude of the burden. How common, or what's the prevalence of sickle cell disease in Ghana?
So currently, the figures, there was a research carried out in Kumasi, and of all our newborns,
Right.
2%
2% of newborns.
of our newborns have the sickle cell condition.
Condition.
Yes, but if you look at, you have to have the S.
Right.
And about 25% of our population have the S. That means that the potential of two people having the S coming together is very high.
Okay.
So about a fourth of our population carry the S.
Right. So that is their carriers.
They are
They have
carriers.
the sickle cell trait.
Yes, and then so once they have the traits, then once they come together, then their offsprings, their children,
Right.
can have the sickle cell condition.
Okay.
Yes.
Right. So that's a significant number, and we should be looking at this.
Very significant.
In other parts of the world, newborn screening is almost mandatory, right? And they are able to pick up some of these things and do a lot of prevention work, if I can say so. How are we with regard to newborn screening in Ghana?
So it's all, we discussed it last year.
Yeah.
So some work started. It's going on, but it's not on the scale that we would like it to be. Not many facilities are doing it. You've got to get to particular facilities to get it done. And of course, when the children are picked up to the issue about care for them, the cost involved and all that, recently hydroxyurea has come in,
Right.
and we are hearing that the program is running out in August. What's going to happen? Is NHIS going to take it up? So it's the whole idea about making noise or creating the awareness every year is that we think that we are still not where we ought to be in terms of picking up the condition and then adequately taking care of the people who have it. Yes.
Right. If you just joined us, 18 minutes past the hour of 2 on Joy 99.7 FM, we're celebrating Fathers today. And we're also marking World Sickle Cell Day, which was yesterday, the 19th of June. Every year since 2008, the UN General Assembly declared 19th of June as a day set aside to raise awareness, mobilize resources, funds, action towards the prevention, the management of sickle cell disease. If you have any questions, concerns, experiences, you can share them with me on WhatsApp 055 11 11 997. And of course, we're live on Facebook and YouTube, so you get to see us. These days, we have to be very serious in the studio because you can see everything we do, even when I pick my nose, if I do that, right? But great to have you. We're going to be learning what sickle cell disease is, what the challenges are. Nimate in the studio is a better resource person than me, right? Because he lives with the condition. He can tell you the impact on his family, his life, his work. And now he can actually talk about the impact on his marriage as well, right? With permission from Madame, I see the eye she's giving him. Some people call it sign language eye. Right. So, Doc, let's just quickly, it's a genetic condition. It's inherited. Let's break it down.
It's a genetic condition. That means that it's carried in your genes, the basic component of your body that makes you who you are.
Right.
So it's like a message. It's like a code in your body, which is transmitted to your children. So what happens is that for you to have a sickle cell condition, you should have two abnormal hemoglobins. And not you have to go back to the basics again.
That's right.
So blood, as you see, it has certain components. There are certain cells in blood. The commonest, the most abundant of them was what we call the red cells.
Red blood cell.
And red blood cell. And it's like, I always use the donuts, the one we buy from the malls, not the one we buy from the roadside.
You know who?
the one with the ring.
Not both fruits.
Not both fruits, yes.
Donut.
The ring donut.
Right.
With the sugar sprinkled on it.
That's right.
So if you look at the donut as the cell, then the white part, the flour part in it, is the hemoglobin.
Right.
All right. And the sugar on it is what there are certain substances that determine your blood group.
Okay.
I'm starting because I know questions will start coming.
About blood group and then
so
HB.
we are talking about the flour part, what is in the cell. And there are different types, but the normal is A. All others, we say they are abnormal.
Okay.
So we have C, we have S, we have D, we have K, we have all the others.
Right.
If you have any two abnormal ones, abnormal hemoglobins.
So this is abnormal hemoglobins.
Yes.
Different from your blood group.
Different from your blood group.
Okay. Right.
So if you have two abnormal hemoglobins and any of them is S, they have sickle cell condition.
Right.
So if you have SC, both S and C are abnormal.
Right.
So it's sickle cell condition.
Right.
If you have SF, both S and F are abnormal. So sickle cell condition.
Right.
If you have AS, it is not a sickle cell condition because A is normal.
Right.
If you have AC, it is not a sickle cell condition because A is normal.
You have a normal.
If you have CC,
Right.
it is not a sickle cell condition because C, they are both abnormal, but there's no S.
Okay.
So you've got to have two abnormals. One should be an S.
Okay.
Then you have sickle cell condition.
Right.
And everybody has two, as I mentioned, AS, SC, SS, and others.
Okay.
You take one from each parent. So your mother gives you one, your father gives you one.
Right.
Okay. I am AC, and I've been able to trace that. My mom gave me the C,
Right.
and my dad gave me the A.
Okay.
Yes, we can do that kind of permutations, and we
Right.
know.
So everybody should know their hemoglobin status. Type. Okay.
Yes,
Right.
hemoglobin type.
Type.
Yes.
Right.
And yes, and
Because if you're thinking of getting married and having children, then these types and the pairings they will deliver or yield are
Yes.
very, very critical and
so there will be some
important.
permutation.
Right.
So when a man and a woman come together, there's some permutation which is beyond us.
Right.
But there's some permutation that goes on, and it will always result in at least two. So every child will have two. So if you have the S, and your partner also has an abnormal one, then you can get a sickle cell child, a condition, a child living
A child with the condition.
with a condition. Yes.
Right. But not a child with the sickle cell disease.
A child with sickle cell disease.
Right. Okay.
Yes.
But if you have the two abnormal,
If you have two abnormals,
Right.
and there's one S,
there's one S.
then the child has sickle cell disease.
Okay.
If there's a normal A, there is no sickle cell disease. So
Right.
AS is not sickle cell
Okay.
disease.
Can you distinguish for my listeners when do we say sickle cell trait and when do we say carrier?
Okay, trait and carrier is the same.
That's right.
Yeah, trait and carrier is the same. So the carriers are the people who have the AS.
Right.
So they are carrier. They have the traits.
Right.
And they can pass it on to their children.
Okay.
But they themselves,
They don't have the
they don't
symptoms
have
of the
condition.
sickle cell disease.
They don't have the condition at all.
Great.
They are normal.
Okay.
But then they can carry on. They can carry it on. They can
They
pass
can
it
pass
on
it
to their children.
to their children,
Their
and
children.
if they pair up with somebody who also has an abnormal, there's a higher
Abnormal.
chance.
Then you get sickle. The chances are high.
Okay.
Now, let me also say that there's also sickle cell anemia. That is solely for the SS people.
Okay.
Because sickle cell condition, SC, SF, S beta tau, SD, all the others are sickle cell conditions.
Right.
But the sickle cell anemia is the SS, which is the severest form of the condition.
Okay.
Yes. So these are just terminologies that.
Okay. I'm sure you are getting overloaded with letters F, C, K, Y, and all that. But basically, we want to raise awareness of this condition. If you have any, should I say, knowledge of this within your family, you can share with us. WhatsApp 055 11 11 997. And we can answer your questions as well. That's why Dr. Tete has kindly made himself available today. Nimate, all this AFFFF of F, right? Some people listen to the budget or the state of the nation, and then they look at how it impacts their lives directly or whether they feel it in their pocket. So these letters we are talking about, you feel it in your life, right? You are SS? Oh, yep.
Sure.
Sure.
MSS.
Right. And how has this changed your life? I'll get into some of your experiences in a bit, but just an overview statement. How has this impacted your life?
Basically, I would say I've had to live a different life from what we would consider the normal. I think the last time we had a discussion, I told you, growing up, in fact, developing itself, it delays your developmental process.
Okay.
Okay, so most of the things I should have been doing at age 7, I end up doing at age 12 or more.
Right.
Yeah, so it slows down and it interferes with your life. Educational status-wise, I mean, I could say that I spent about 1/3, if not half, of my schooling life in hospital.
1/3 of your schooling life
Yes.
in hospital.
Exactly.
Not even just going to hospital and going home, but in hospital
In
on
hospital.
admission.
Exactly.
Wow. I'm listening. Yeah, how it's impacted your life.
So basically, that's it. It's. I mean, you can't live that kind of normal life you would want to live. The things you would want to do. I mean, other children as growing up.
Right.
Things other children are doing, playing football, soccer, swimming. These are things every child would love to do, but I can't do that because of my condition.
Right.
And you don't need to stress yourself too much, because the least stress, and then you run into crisis. The other thing too is that you are constantly reminded to be taking a lot of water. Of course, it's good for everyone though, but in your condition, you have to take much more.
Right.
As it stands now, I don't do less than 3 liters a day.
Right.
Yes. Anytime I go less than 3 liters, then I should know that
you have some
I'm
challenges.
having some challenges, or I'm running into a default.
Okay. But Nimate, you work as well, right?
Yes.
You've talked about the significant impact on your education and growing up, right? But you work. How has it impacted work, and how do your employers understand this challenge that you had no choice in, you inherited?
Currently, I've had to switch jobs.
Right.
So I'm into photojournalism right now, and then I
Okay.
do media liaison, among others.
Right.
As it is, I'm not fully employed. I'm
Right.
not in any full-time employment.
Okay.
So
But before you were?
before I was,
Right. I just want you to give us a glimpse, right? Just, it's not everything, and I don't really need to mention if you're not going to mention who your employers were, but you're a full-time worker, or you're a worker, an employee, and you have this condition, sickle cell. Just
Yes,
give how did it impact on
I
you?
would say my previous work, it hadn't impacted so much because, one, I know what I was living with, or I'm aware of my condition.
Right.
So I do so well to take care of myself.
Okay.
As much as possible, I make sure I don't run into crisis. And I switched job because of interest.
Okay.
I felt much more comfortable
Right.
with what I'm doing.
Okay.
It's more of a hobby which I had taken as a profession.
Right.
Yes. So I would
You
say
went
this
you
is-
went forced out of your job.
Pardon?
You went forced
No,
out of
not
your
at
job.
all.
Not at
Not
all.
at
Okay. But when you get sick and you're on admission and all that, does your employer understand? Are there any workplace or job related accommodations that give you a bit more comfort than other workers who don't have the condition you have?
Like I said early on, currently I'm not full-time employed.
Right.
I'm doing some part-time with one media organization.
Okay.
And I would say the doctor, we have an in-house clinic.
Okay.
Yes. The doctor over there, I would say the team at the clinic, they are very good.
Okay.
The moment I have any challenge, I run to them. But it's hardly difficult that I get this kind of, I fall sick in the line of duty.
Right.
Yes. As far as I can remember, it's only been once.
Okay.
And that was
It's
2
been
years
good
ago.
to you.
Yes.
Right. It waits till you're on your way home or at home. But
Well,
still a challenge.
It's still a challenge. It's still a challenge. As much as possible, one, because you're also not into full-time employment, you get to bear the responsibility on your own when it comes up like that.
Right.
Mostly, you realize that even at work, you are not feeling too good, so you have to find your way out, go home, or go and see the doctor.
Okay.
I think I mentioned here 2 years ago or 3 years ago that as we speak, as at the time we spoke then, there was no 24-hour facility running at the Sickle Cell Clinic Center at Ekolibu.
That's right.
As we speak today, 3 years down the line, it's still the same.
Right.
So for me and my family, I attend a private hospital. It is very expensive. Doc mentioned it's very, very expensive treating sick or living with sickle cell. It's quite expensive.
Wow. All right. If you've just joined us, it's 29 minutes past the hour of 2 already, and we're talking about sickle cell disease on the back of yesterday, World Sickle Cell Day. You just heard speaking Nimate Botre. He's living with the condition and he's sharing the impact on his life. And I do believe he's being very, very, very diplomatic and modest about it. But I'll pick at him for him to share a bit more. Nimate, you got married last year.
Yes.
Now, with all this challenge, it affected education, it affected work, it's still affecting work and life. You told us a few minutes ago you can't do things other people do. But you managed to get married.
It wasn't easy.
Share a bit of that.
I have always known that I live with a condition.
Right.
It would interest you to know that my first date with my wife, my then girlfriend, on our first date, I sent her straight to the hospital, to the clinic to take a sickle cell test
Okay.
before we even went on the date itself.
Right.
Yes, I want to be sure what I was going to commit to.
So you tested before a date.
Yes,
And you
on
still-
our way to the date. So we drove to the. In fact, I
What kind
ordered
of life
the
is
Uber.
that? What kind of life is that?
I know.
You are taking your advocacy too far. Date 2, you went to test. She had to qualify.
Not qualified per se, but
Biometric
I
verification.
tell you, based on previous experiences.
All right, we're playing this down and adding a lot of humor, but it meant a lot to you.
It meant a lot to me. So
Right.
I told her we were going on a date, and I remember we went to Junction Mall, KFC. But before going to KFC, we passed through Bachona, through the clinic.
Mm-hmm.
And I insisted that she takes the test first.
Okay.
So we took the test before actually going on our first date.
What did you want to know?
I want to be sure she's not a carrier
All
or
right.
has the condition.
Okay.
Yes.
Because if she was,
If
then
she
that
was, I
would
would have to pull the brakes.
that would impact on your choice
Exactly.
of a partner. Exactly.
As I said earlier on, based on
Before
previous
Junction
experience,
Mall, before KFC, before fries, chicken, you wanted to know this.
I wanted to know.
Wow. So she passed that test. You ate your chicken and stuff, and all
Yeah,
right.
she passed.
Right. But there were other challenges, weren't there?
There were other challenges. My wife's younger sister has been my very close friend.
Mm-hmm.
So she happens to know. I share a lot with her.
Okay.
We talk very much.
Right.
So she knows that I live with a condition.
Right.
And my wife also knows. I
Okay.
mean, even before we went on that date.
Right.
So her family has been very supportive. Let me be
Right.
honest. As much as my family has been supportive.
Mm.
She introduced me to a few people, her work bosses, and along the way, challenges started coming. You know, I had a crisis. I wouldn't say you can't even qualify crisis as major or minor. Crisis is crisis. So I had, but I would say minor because of the level at which sometimes the pain is unbearable.
Right.
And I can tell you that I have a very high tolerance level for pain.
Mm-hmm.
The last time I went into, in fact, I had a fracture in my leg. I went to the hospital and the doctor was like, "Are you okay?" I said, "Oh, is the pain?" I said, "It's normal." Then he said, "No, it's not normal. It's because you have a very high tolerance level for pain. So
Right.
you would consider it a normal pain."
Right.
And like I said early on, when we started dating, challenges, he introduced me to a few people. Then I had crisis on the way. Sorry, I had crisis along the way.
Right.
And I was taken to hospital, admitted. So she had to come and spend some time with me at the hospital. And she called the office to
This
let
is
them
before you got married.
before the marriage.
You had a crisis.
Yes.
You'd had this premarital test which she had passed.
Yes,
Then you have a crisis which is like
Exactly.
the real deal.
the real deal.
Right? She gets to see the pink sheet and she has to live it before
Exactly.
the actual marriage. Wow.
So she called the office to let them know that this is the challenge. And I think maybe I would say it's out of concern. They were worried about her. In fact, then calls started coming from various quarters. Some friends, I mean, different people. You have to call off this relationship.
They wanted you to step down
No, they were advising
or
her
for her to step down,
To step down.
not to contest.
Yes.
Wow.
So she stood her grounds. In fact, I remember one of the conversations at one of the meetings actually to convince her to step down or to call it off. The response she gave them was that I was the man she prayed for.
You were the man she prayed for.
Exactly.
And therefore, everything you came with was what she prayed for.
Exactly. And she's been very supportive.
With your condition, you were her answered prayer.
I tell you.
Wow. Wow.
So fast forward, December 2019, 12 December.
Mhm.
I went to work. And then on the line of duty, I had crisis. So quickly, I had to rush myself to the hospital. I was admitted. The following day, 4 p.m., I was discharged. I got home. By 7 p.m., I had a relapse. I had to go back to the hospital. I was admitted again on that same Friday, 13th. 14th, which was a Saturday. Around 2 p.m., I realized my breath was not enough. I couldn't have enough breath. So I drew the attention of the doctor. And he placed me on oxygen for about 2 to 3 hours. And the oxygen ran out. And this is a private facility.
Right.
So what I understood was that they had a patient before me who was on oxygen throughout the week.
Okay.
And that was how come they ran out. And it was a weekend. So what do? He asked that he wants to transfer me. And my doctor is he pays attention to detail.
Right.
Dr. Fudego of
Right.
Ifan Victory Clinic.
Right.
Yes, so he guided me through what was really happening and told me that he needed to transfer me
Wow.
as soon as possible. So I had 3 hospitals at options on my table: Lekma, 37, and then Ridge.
Right.
I told him Lekma was out. I wouldn't go to Lekma. So he said, well, I said 37. He calls 37, and unfortunately, they said there was no bed. And
Wow.
having worked with them before, I had to call one of the generals.
Okay.
And when I called him, he was like, in fact, he didn't even know I was the one. I told him I wanted someone to be transferred to, like, I wanted to transfer to 37. That's what I said. I was like, General, minto ma transfer keva 37. It's like, Hani bomwe batrami. And I said it was myself. So quickly, he made calls and they had to dispatch an ambulance. And when the doctor made the call, he insisted that the ambulance should have an oxygen.
Right. These are essential things
Exactly.
we're talking about, but they don't come
Exactly. They
that
don't
easily.
come. So ambulance arrives. Arrangement has been made for my transfer to 37. Ambulance arrives, and then we move to 37. And I would say that my wife was with me throughout the period. And I know she was scared, but she was
She hadn't
really-
married you yet. She's
Not.
already doing ambulance rides with
I
you,
tell you.
looking for oxygen and all that.
So we were in the ambulance together, and my family has been very supportive, hers as well.
Wow.
So we got to 37, and because I had spoken to General, he had made some few arrangements. I got there, the doctors were ready to receive me. They had to make an alternative bed. The truth was that they were now trying to fix a bed because the doctor had called earlier and there was no bed. But because of the call that went through, and see, again, it comes back to, equipping our hospitals.
Right.
Here's the case: if I hadn't known anybody there or had
Not just anybody, a general.
exactly,
And even with that, there was
exactly
a
So
challenge.
it comes back to our equipping our health.
So if you knew a
facilities.
corporal or some, goodness.
So then I get to 37. I'm admitted. I was on oxygen. They were reading my pulse throughout the period. From the ambulance into the ward, medical emergency, I was on oxygen. And I was to take a chest x-ray. So my pulse was being checked. And once I was going to the x-ray, I had a mobile pulse checker.
Yeah.
And then the instruction was given to the nurse. The moment it drops to 85, bring him back immediately. We took the x-ray and then it dropped to 85. So quickly, I had to be rushed back to emergency, placed on oxygen. And I was there for a couple of days. In fact, I remember on the 17th December, I got so tired. I was in severe pain. So around 2 a.m., I called my pastor. I told him I was tired. He should pray with me and send me home.
You told your pastor you were tired.
I told him I was tired.
Not
And
tired of the hospital, tired
I
of
was
life.
tired of everything.
Everything.
And in fact, before making those decisions, I thought of a few things. My mother had always been praying that she doesn't want to bury any of her children. She's buried one already anyway. So I told myself, she has 6 other children to live with. I thought of my wife as well. I said, well, we've known each other. She'll find someone else.
But at that time, she was your wife to be.
She was my wife to be.
Right.
I
And
was
you,
like-
you were saying goodbye.
She was fine. I was tired, honestly, Doc.
You know what? Let me give you a break. Folks, if you've just joined us, 39 minutes past the hour of 2, you're just hearing the story of somebody living with sickle cell disease, Nima Tebotre, and he's been here before. I remember a couple of years ago, Nima shared with me that there was one very, very, very terrible crisis in Kolebu, and he knew everything his mother went through on a regular basis. So, unknown to his mother, unknown to his family, he was praying that that particular crisis should be his one-way ticket and should take him away. And it was something he disclosed on this very station, I remember, that, yes, sometimes it gets so bad that you give up, and then you also want to free those who care for you, those who love you. If you have anything to share, WhatsApp is 055 11 11 997. Doc, let me come to you. I'm looking at Mr. and Mrs. and
I was enjoying the story.
yeah, I know. The real life stories are what we need to harness for our advocacy. A lot of people don't understand that behind just the diagnosis or the HB group is a whole human impact story. And these realities he talks about, you need oxygen, you need this, you need that. There's no 24-hour service or specialized facility. How does that make you
Yeah.
feel?
These things, and let me say that, I mean, I admire him for telling the story. I mean, you see that he's taking his time to narrate it, and I'll say kudos to Madame too for staying with him, because the support system is very important. All right, both the health.
I'm tempted to give her a microphone now.
Both the healthcare system
Wow.
and the family support. And he kept saying both families have been supportive. That's the important thing. And you realize that in all these, I mean, you need certain things done. An ambulance to convey the person to hospital, oxygen has to be available. You need to check the saturation at every point in time.
Right.
So it's a whole system that we need to come up with, like build, to help our people who have the condition. And he mentioned the unavailability of a 24-hour facility.
Right.
At the Community Teaching Hospital, we have a sickle cell clinic. It closes at 4 or I think 5. Then if there are any
Every
problem,
day or just weekdays?
weekdays, Monday to Friday.
So weekend there is no cover.
Weekend there's no cover. You end up at the polyclinic or at the main Kolebu emergency room, abstinent to the emergency. If it's a weekday and it's after 5, you'll be transferred to the emergency or the polyclinic, and then they will take it over. But the problem is that, you know, with sickle cell, they need particular care. I mean, in the emergency room, there are so many other conditions, so many other people who come with all sorts of conditions. So sometimes when you have so many patients and the human resource is not very, it's not adequate, you tend to not intentional, but you overlook some of the things that they complain about. So I agree with you. We need a place where 24/7 they can, no matter the day, no matter the time,
Right.
they can have access to the to health, to care. And then the other issues about transfer to hospital and all that, ambulances, when you need oxygen, you need to take an X-ray. You can end up in a facility where you don't even have an X-ray. You have to move from one facility to the other to take the X-ray.
And these are medical emergencies.
Yes, and you can just imagine if he had moved about maybe 1 kilometer and oxygen had dropped to about 85.
Right.
Getting back to the emergency, what would have happened, and all these things. So some of these things, I'm sure listeners it's like a story,
Right.
but it is not very pleasant if you are the person.
So if his family had lost him some along this path, this chain, we probably say, oh, sickle cell. But it
Yes.
really is a reflection of
the whole system.
The whole system.
The whole system,
Right.
yes,
So
yes.
such a person would not have passed away because of sickle cell,
No,
but because of the
but
inadequacies
the system.
along the chain.
Yes.
Right. Let me just Ransford in Tema says, Nortey, you let the story flow. Ransford, there's anyway. Okay, we are flowing. Right. Sometimes I want to capture a specific point and make sure it stands out. Okay, and also cover other things we've set to cover ourselves. And very often, because it's a weekly program, I look at our time and what we've covered, and then whether we want to come back and continue next week. So, Ransford, I understand you. I feel the same way. I don't want to stop him at all. In fact, I want to go home with him and his wife and continue the story. Ask my brother is very right, and sometimes you just wish you are not alive because it gets to the point where the pain becomes so unbearable. Ask my brother about priapism so he can educate SS patients on that. And I think, Doc, you can talk about that. My wife left me because she was tired of taking me to the hospital. This is shared by somebody who does not share his name. God bless you for sharing and enriching our program. So he's talking about one of the challenges, priapism.
Yes, no, before I get there, let me say that he is in Accra.
Right.
He's Accra.
Right.
With all the things in Accra.
Right.
Several facilities, specialist doctors, oxygen available. So you can just imagine if he is in, let me say, my mother's hometown, where even the facility, the distance between facilities, it would take about maybe.
So we're looking
8
at Accra,
hours.
where we're dense with regards to our health facilities
system,
and
yes,
resources, and people are experiencing
all these things.
horrendous challenges. So
And even movement in Accra is easier. In some places, movement is not that easy. Even
know.
getting the car is a problem.
Right.
And it takes hours to get to the nearest facility. So you can just imagine our brothers and sisters who are out of Accra scattered all over the country, and that's where the problem is.
Right.
Yes.
Okay.
And then you mentioned priapism.
Right.
Yeah, priapism is a condition. It's one of the acute conditions that they get. The crisis, part of the things that they experience, where they get a prolonged, sustained painful erection.
Right.
So it happens to the males. So they get a sustained painful erection. So the males, you can get an erection for hours, sometimes 12 hours, sometimes it can last for a day,
Right.
or even more. And the thing about that, it is painful. And usually when we if it's just
And
an
it's
erection,
a medical emergency.
yes, an emergency, because if it's not attended to early, it can lead to you losing your sexual function. Yeah. So what happens is that the blood, the blood flows into the organ,
That's right.
and instead of returning back, the blood flowing back, it doesn't. The vessels are clogged, sort of.
Right.
So the blood stays there. The erection continues for hours, and it's very, very painful. And sometimes they need surgical intervention. I've been in theater where they actually have to drain the blood out of the male organ, sort of drain it out virtually, so that it returns back to it. And even that, sometimes it takes days for it to reverse
Right.
back.
Okay.
Reverse, yeah.
Right, 47 minutes past the hour of 2 on Joy 99.7 FM. We're talking about sickle cell disease. I have a hematologist you just heard speaking, Dr. Eugene Tete of the Kolebu Teaching Hospital, and next to him, Nima Tebotre, who is living with the condition and sharing his life experiences as if it's a story he's telling, but he goes through this every day. Nimate is one of our courageous advocates. There are many living with this and the challenges, related issues silently. And it is only when we raise awareness, mobilize responses, community support, family supports. Some families don't understand this and therefore push it away. And when it comes to significant life transitions and choices like marriage, it's another different ball game. If you have any questions, concerns, send them to me. WhatsApp 055 11 11 997. Let me activate the phone line 0302 216 We can get in some questions. This is Ultimate Health Father's Day edition, and we are also marking World Sickle Cell Day, which was yesterday, the 19th of June. If you have any questions, experiences, concerns, if you know a father, even a mother, managing, supporting a child or a partner with sickle cell disease, call us and share, and let's celebrate that person and their immense support that they are giving, or give them a cushion for the challenges they're going through. So, Nimate, Ransford felt I was stopping your story. So there were challenges. Your wife went through all this, stuck by you, and you got married last year in February.
Exactly.
Right. Now, earlier on, you mentioned that thankfully, right, the attacks or the crises tend to happen when you are away from work. But away from work doesn't mean out of your marriage. Now, since you got married, have you had any challenges that has brought the two of you to a serious dilemma that you didn't foresee?
No, I would say the December 2019 episode was the highest hit. Remember the last time I came, I told you
Right.
I had one previous highest hit, but I would consider that as my highest hit. 'Cause
Right.
even after 37, I was discharged, came home 3 days later, which was my birthday, 24th of December.
Wow, Christmas Eve.
Yes, I had to be admitted again, and then I was transferred again to Ridge Hospital this time. And for me, it's more about the support system.
Right.
My family was there. My then girlfriend was there. In fact, at Ridge, my two sisters took turns. So one would come today, spend the whole 24 hours. The following day, the other would come. So they were running shift for as long as I was there.
Wow.
And that was how that time. But beyond that, I think celebrating this 19th June ceremony,
Right.
we should look beyond that. It's something we live in. Just celebrating it or observing it once a year, it's really not helping. In fact, like I said, advocacy, yes, I'm into it, but these are with my own resources. And it takes a lot of time, takes a lot of resources, time, and then moving around. And this is Accra. So if we even in Accra, if we are having challenges, and unfortunately for some people who are even, I have always stressed on stigmatization.
Right.
The word sickler pisses me off. Let me be honest.
Right.
It's a complete turn off for me. It feels so disrespectful, in my honest opinion.
That's why I keep saying you're living with
Yes.
the condition.
The moment you call someone a sickler, so there are times people see you, then, because of the color of my eye. So the first question they ask you, are you okay? And I ask them, do I not look okay? You see, then they follow up, are you a sickler? And in fact, some of them even come from health professionals. Okay, nurses, doctors. I remember I met a doctor on an assignment. And this is a medical doctor, a specialist for that matter. And the first question was like, are you okay? And I said, I'm very fine. He said, the color of your eyes. I said, that's how they are. Then she continues, are you a sickler? So I just turned and walk away. No disrespect, but calling people sickler.
Right.
And yesterday I saw something on Facebook. This is an advocacy group. I don't want to call them out.
Right.
And here, Doc, you can have a look. Okay. They have specified the categories of careers or blood types.
Right.
Okay. And then here you mention SS and you say sickler. This is an advocacy group.
Right.
For crying. So, one, what are
We
you
need to
advocating for?
educate
Exactly.
ourselves.
So if you are advocating for sickle cell disease,
Right.
someone lives with a condition. It doesn't make them a sickler. And sometimes I look back, I tell my wife, I look back or I look at people around me, those who are not even sickle celled, and I know I'm doing much better.
You're doing great.
I'm doing fine.
And you see, the thing, listeners, you may not know, but we've gone through a lot with some of these courageous advocates. Nimate and I lost a good friend and strong warrior. And indeed, that Jasmine, and I when he mentioned being on admission on his birthday, and I remembered a fight I had with Yasmin. One day she was on admission, and I think it was her daughter's birthday or her birthday, and we were restricting visitors and certain things because of the situation we're managing. But she managed to sneak, and there was not sneak out in the room. Right, the private ward, balloons were brought in and stuff like that, and she had a real good go. So when I got there, I said, "My friend, you know what we're dealing with." She said, "No. As for this one, no way. It had to happen, and I'm glad I did it." And sometimes you forget that there's a life there that is being challenged by some of these things, and bless her memory. And bless her strong daughter Inaya and her mom and everybody, and the many advocates that she trained. And we've lost a couple of them along the way. I can remember. Did you meet Dr. Paul Mensah?
Yes,
Yeah.
Paul was my boss.
Yes,
Actually,
we lost Paul.
trained me.
Yeah, Paul
Yes,
also
Paul was a
strong
man.
resource person on this
Yes,
program,
very
but
strong.
he was living with the condition and he
condition,
succumbed
yes.
to it at
Yes,
some point.
at some
So
point,
I'm always humbled when I have courageous advocates. But
The
yeah.
thing about sickle, so that's why we always do these things: education, advocacy. And yesterday we had a webinar for health practitioners.
That's right.
And we kept saying that. We emphasize the point that they are not sickless, and we say people living with sickle cell disease
Right.
or living with sickle cell condition.
Right.
They are not always sick. And actually, I know a lot of people who have sickle cell disease who have stayed for months and sometimes years without having any acute events,
Right.
like no crisis, nothing. So they are not always sick, and we always try to remind people that we shouldn't call them sickless.
All right.
Yes, and but again, the education, as you know, it takes time for these things to sink in. So sometimes you find doctors, even senior ones,
It's kind of
referring
like
to
painting
them.
over stubborn paint. You keep on
Yes.
painting until you don't see the color again.
Yes, but we'll keep
on
reminding
doing
them,
the
yes,
education.
that
Let me
they
just
are
quickly
not
read
sick.
this out. This says, "Good job, Nortey. This is Regina. I'm a mother with two daughters having the SS genotype, 22 and 16 years old. The eldest turned 22 just yesterday on World Sickle Cell Day. Can you imagine? Her birthday is actually the World Sickle Cell Day. Many, many, many blessings to you, Regina, and thanks for sharing. Good afternoon, Nortey. Please, hang on. Let me scroll down. Please, I think we should have a show where we talk about the available and potential cures, bone marrow transplant. No, we have a whole range of things we haven't discussed
Yes,
today, right? We started a bit late, and also initially we're not to have a program because of football, and then the arrangements change, and they are doing a different connection. So we've squeezed it in, but we'll do more education on all the available interventions
options,
and
yeah.
management as well, and also ways of preventing the disease. All right. So thanks for sharing that. I have this one says, I am an God bless Nee and his wife. My prayer for him is for God to grant the wife more strength, not to leave him at the peak. Okay? You can say that again, my brother. Are you a sickler? Pisses me off. Cra. This is somebody reinforcing that point. I need your assistance so I can also advocate on that too. I'm an SS patient, and I do activities more than those who say they are AA and AS, etc. We have SS patients who are stronger, and I am 34 years and still counting, inshallah. All right, so I'll take your number and put you in contact with Nee and a few others. This is one of the challenges. We've run out of time, but one of the challenges, Nee, and I'm sure you're aware of this, is that there are so many advocacy groups. In other parts of the world, they come together as a cluster and they do better work and they synchronize. It's one of the challenges I've had over my several years of doing this program. There are different support groups, and everybody wants to get their funds and their attention and so on and so forth. And we need to probably start looking at this angle of it, bringing the support groups together so that they can attract more resources and then spread the impact across. And we need to, resource them as well. So quick words from you and Doc, and then probably next 2 weeks, I think next week there's football, we'll see how we come back and educate in depth.
Yeah. So you go.
Yeah, Nee.
Okay, so in terms of resource groups, like you said, advocacy group, everybody is trying to create something on their own. And I think it's more about a bossy kind of thing. Everybody wants to be a founder, CEO, something foundation. And of course, I was doing solo. I've been doing solo all my life until I met Yasmin. And I partnered with Yasmin. I mean, I felt the two of us could put us straight together. And Yasmin was getting people along. But like you mentioned, everybody wants to have his or her own advocacy group. And this is not helping, because then you realize that we are all doing the same thing, going around in circles. And information coming in sometimes is distorted along the way, because you don't have the adequate information with your group, but then you are pushing what you feel is right. Somebody else is pushing. But if we, like you're saying, we come to an umbrella group, okay, that would make a much bigger difference. Again, I agree with that. It's something we should all look at.
We'll work on that. Okay, Doc.
Yeah, Nortey, I would say that, I mean, things are getting better. We've not mentioned the new options we have.
Yes.
Hydroxyurea
and all that. Yeah.
Bone marrow transplant. We did something at Ridge. All those things are there, and there are some research. The research is going on with some medications for sickle cell patients. But I will end by saying that the thing is for everybody to know your hemoglobin type. Everybody, you should all know yours. And then as he knew his, so he was empowered to take a decision, and that's how come he let his girlfriend to test. And then once you know, you make an informed decision. And if it happens that you have sickle cell disease, then you know what to do. You know how to take care of yourself, and then you can live a life, and it should be as normal as possible. Yes, and so everybody should get tested. The sickling test is not enough. Ask that you want to know your HB genotype. You want to hear those two letters, whether it's AA, AC, whatever it is, SS, SC. You want to get to know, and that's the first point of getting informed and then getting empowered.
Know your status, and then you can unlock the door to the interventions that are needed should you have the condition. Okay, right.
I think most important, what I'll just add is that drink a lot of water.
Yep.
Keep hydrated. It helps.
Keep hydrated. All right. We'll come back to those specific tips and details. Madam, I thank you again, though you are not in camera shot. Niimate, we'll come back to this again, and then we'll start looking at this idea of pulling the support groups together. And then, Doc, we'll go into the details and the specific tests, the management and things, and then the resource challenges, right? Some years ago, we were thinking of just simply putting water dispensers at the sickle cell clinic in Kolebu. We got some of the dispensers, and now filling them or refilling them became an issue because even people who shouldn't be drinking the water were drinking the water. So we've got work to do. Many thanks to you, my discerning listeners, and my producer, Abeku Sankofi. My understanding is that the sports guys are revving up to come in. So I will give them my seat, and we'll come back with more on this, I think, the week after next. Thanks for staying on Joy 99.7 FM. Stick and stay. Sports is up next.
Flitting around the penalty area, and it's number 4.